Assalamualaikum. Today we will discuss about the clavicle. Clavicle, the word comes from the Greek klidon or Latin clavicle. The meaning of both are little key and it looks like the little key. The clavicle, it is also called the beauty bone in case of the female and called collarbone in case of the male. It forms the pectoral girdle along with the scapula. Here we can see it forms the pectoral girdle along with the scapula. Now the parts of the clavicle, it has two ends and an intervening shaft. This one is the medial end, which is also called the sternal end as it articulates with the sternum and forms the sternoclavicular joint, which is a saddle type of synovial joint, and the lateral end, which is also called the acromial end. It articulates with the acromion process of the scapula and forms the plain type of synovial joint. Now come to the shaft. The shaft, it has two portions. The medial 2/3 it is cylindrical in shape and lateral 1/3 it is flattened. So come to the medial 2/3. It has four surfaces. This one is the anterior surface, this one is the superior surface, this one is the inferior surface, and posteriorly there is posterior surface. In the lateral 1/3 it has two surfaces. This one is the superior surface and this one is the inferior surface, and it makes two border, anterior border and posterior border. In the posterior inferior portion of the shaft there is a bony projection which is known as the conoid tubercle. Now come to the anatomical position. Now come to the anatomical position. So first of all we have to say the position of the conoid tubercle. The conoid tubercle, it lies in the at the junction of the medial 3/4 and lateral 1/4 of the shaft and lies postero inferiorly. Here the conoid tubercle. In the shaft, the medial 2/3 of the shaft convexity is forward and lateral 1/3 of the shaft is concavity forward. In the middle third of the inferior surface of the shaft, in the inferior surface, it is marked by the subclavian groove. So morphological type of the bone. Morphologically, clavicle is called modified long bone. So first of all, we have to know why it is called long bone. We know in a typical long bone, there are two ends and an intervening shaft, and clavicle has also two ends and an intervening shaft. And we know the long bone helps in transmission of the body weight, and clavicle also helps in transmission of the body weight by the coracoclavicular ligament and costoclavicular ligament, and it transmits the body weight in the axial skeleton, that is in the sternum. And now come why it is called modified long bone. So see, in a typical long bone, this is humerus. We know in a long bone, if I cut a long bone, it has a medullary cavity, but if I cut the clavicle, it has no medullary cavity. Long bone situated vertically in our body, but clavicle is the only long bone that lies horizontally. In the long bone, some portions are covered by the muscle and some are subcutaneous, but clavicle is the only long bone that throughout its extent it is subcutaneous. In the long bone, for the shaft, there are only one primary ossification center, and for the two ends, there are two secondary ossification center. But in the clavicle, for the shaft, there are two primary ossification centers. So it violates here, because we know in the shaft there are only one primary ossification center. And the clavicle, it is pierced through and through by the cutaneous nerve, that is middle supraclavicular nerve. But we know in the other typical long bone, they are not pierced by any nerve. So it is the only bone that starts its ossification first, that is in the intrauterine life, 5 to 6 weeks of intrauterine life, and completes its ossification last. Now come to the joint. The medial end, we know the medial end is saddle shape and it makes joint with the sternum. The name of the joint is the sternoclavicular joint, which is a saddle type of synovial joint, and in the articular surface there is a articular disc, and that disc is a fibrocartilage. Usually we know in case of the other joint the discs are hyaline cartilage, but it is exception, it is fibrocartilage. And as it is a synovial joint, so around the joint there is a joint capsule, and the lateral end it articulate with the acromion process of the scapula and form the plain type of synovial joint. And as it is a synovial joint, so around the margin there is a fibrous capsule. And now come to the shaft. In the medial part of the shaft, there are four surfaces we know. In the anterior surface of the shaft, there is attachment of the pectoralis major muscle. In the superior surface, there is give attachment to the sternocleidomastoid muscle and the clavicular end of the sternocleidomastoid. In the posterior surface, it give attachment to the sternohyoid muscle, and the inferior surface there is a articular surface, over articular surface, it give attachment to the costoclavicular ligament. Now come to the middle third of the shaft. The middle third of the shaft, we know there is a subclavian groove. In this groove there is attachment to the subclavius muscle, and around the margin, that is anterior lip and posterior lip, it give attachment to the clavipectoral fascia. And lateral to the subclavius groove, there we can see a foramen. This foramen is known as the nutrient foramen, and direction of the nutrient foramen is laterally. So we know in the opposite to this direction of the nutrient foramen there is a growing end. So we can say the growing end of the clavicle is directed to the sternal end as the direction of the nutrient foramen to the acromial end. Now come to the lateral end, lateral 1/3. We know there is a anterior border and posterior border. In the anterior border of the lateral 1/3 there is a tubercle. This tubercle is known as the deltoid tubercle. It gives origin to the deltoid muscle, and we know in the deltoid muscle there are three fiber. One is the clavicular fiber, another one is the acromial fiber, and another one, the fiber, is from the spinous process of the scapula. So here is the clavicular fiber of the deltoid muscle origin. And in the posterior border it gives insertion to the trapezius muscle. Superior surface of the lateral end, here is a bony projection, this is known as the conoid tubercle, and there is a ridge, this is known as the trapezoid ridge. Conoid tubercle give attachment to the conoid part of the coracoclavicular ligament, and trapezoid ridge give attachment to the trapezoid part of the coracoclavicular ligament, and the importance of this ligament is helps in weight transmission. So here the muscle attachment in the medial 2/3, here the pectoralis major, this is sternocleidomastoid, and here in the lateral 1/3 this is deltoid, and the posterior border there is trapezius, and in the inferior surface middle third there is subclavius. From this picture we can see all the muscular origin from the clavicle except two, that is subclavius and trapezius, there are insertion of this muscle. And for the ligament, we know in the medial end there is costoclavicular ligament, and lateral end there is coracoclavicular ligament, and on the two end there are capsular ligament of the joint capsule. So from this picture we can see the ligament attachment in the medial end upper portion. There is interclavicular ligament in between two clavicle. This is interclavicular ligament, and here there is costoclavicular ligament in the medial portion, and in the lateral portion this one is the coracoclavicular ligament, conoid part and trapezoid part of the coracoclavicular ligament, and on the east side we know capsular ligament. Now the ossification. So we know in the bone, long bone, there are two secondary ossification center and one primary ossification center, and clavicle violate this. So for the shaft there are two primary ossification center. Here we can see there are two primary ossification center for the shaft, and the secondary ossification center usually for the medial end or sternal end there are secondary ossification center, and occasionally in the acromial end there may be secondary ossification center. The entire end of the clavicle ossify from the cartilage except its medial end, which ossifies from the membrane. So we can say clavicle ossify in membranocartilaginous process. Now some clinical anatomy. First, it is the most frequent bone to occur fracture, and the fracture occur at its medial 2/3 and lateral 1/3 at this junction. It is the weakest point of this bone as there is no muscle attachment, and this side we know here the nutrient foramen is situated at this side, so presence of foramen it become weak, and it's the site to transmit the weight because here there is conoid tubercle. So in this there is attachment of the ligament coraco. So here is the attachment of the coracoclavicular ligament which helps in transmission of the force. So here the common site of the fracture. I again repeat, it is the junction of two curvature and it is the weakest point, and here is presence of the nutrient foramen. There is no muscle attachment, and at this side the force of the upper limb transmit to the axial skeleton at this side, so it is the commonest site of the fracture. Now some congenital anomaly. So first one is the cleidocranial dystosis. From this figure we can see it is a clinical condition where the partial or complete absence of the clavicle associated with defective ossification of the skull bone. So cleido means clavicle and cranial means is the skull bone. So here we can say the clavicle is absent. In this x-ray we can also see there is no clavicle. So this one is the cleido means clavicle cranial dystosis. So clavicle and the some portion of the cranial bone is not present in this picture, okay, in this condition. And the another clinical condition is known as the clavicular dystosis. Clavicular dystosis means here the shaft defective formational end of the shaft is ossified from this two primary ossification centers. So here the medial end ossify from this center and the lateral end ossify from this center. These center are produced but they fail to fuse. So the two end are fail to fuse. This condition is known as the clavicular dystosis. This is all about the clavicle. Thank you.